Hey there, and thanks for joining me. As you know, I like to start on time, so this webinar is scheduled for 8:30. So at 8:30, we shall start. The topic for today is going to be TB testing in the setting of CNA schools. So we know that as a CNA school provider, that or training program rather, that all CNAs must be tested for tuberculosis before entering the workplace setting. It is a requirement. So you, as the school, have to determine how you're going to fulfill that requirement before the student can even step place into a nursing home, right? This is something that you'll want to make sure that you have done way early in advance before classes even commence, because the last thing you want is for a student to keep saying, I'm going to get my TB test, I'm going to get my TB test, don't worry, I'm going to do it, and next thing you know, you're 3 weeks into the program and it's time for them to go to clinical, but they still haven't gotten their TB test. So this is, I highly encourage you, and in most states it is required that this element must be done and completed before the first day of class. So many of you who may have, I have different policies and procedures, guidelines that I talk to you guys about that I help consult with, and this is one of them. So that is a definite policy and procedure that you need to make sure that you have in place for your business. That if a person is enrolling into your program, they must have the TB test and or chest x-ray completed prior to the first day of class. I highly recommend that, okay? All right, so thank you guys so much for joining me. Tell me what state you are from. I know I have a few people here, and this is a very small course because this is only for individuals who already work one on one with me in some shape, fashion, or form. So thank you so much for joining me. All right, we have Nicole who is in Florida. All right, welcome, Nicole. Thanks for joining. I always like to figure out where you guys are from and where you are in the process. All right, Victoria. Hey, Victoria in Indiana. And I know we have someone else on. I am so surprised that students from my mentorship are not in here, but that's okay. All right, so let's get going and let's start talking about what this would look like. Okay, so first I want to talk about the TB test and why it's important. I know we understand why it's important, but I want you to understand how to interpret the results. So for some of you who may not know, I just did public health. Well, I guess you wouldn't necessarily call it public health, but it's infectious disease assessments for Children's Hospital. And so I got a real good idea of what this looks like when people are potentially exposed to TB, when they're potentially exposed to HIV, and so forth. It was my job to make sure that all the testing was conducted prior to hire. And then if there was an incident that occurred during employment, that we would go in and intervene and do an assessment and figure out what the next option would be. So I got to work closely in doing this for the past 2 years before I started doing this. So I'm really excited to share this information with you. I will be sharing my screen in a moment because there are some CDC guidelines that I want you guys to be able to have. And what I'll probably do is I'll send out an email to make sure that you guys receive this also. I'm going to put them in the chat, but sometimes people forget to like click and save that web page for later. So what I'll do is I'll put them in the chat, but I'll try to send them out to you via email afterwards as well. Okay. So the first thing is the CDC. Again, it is a guideline. It is a regulation that anyone working in any type of setting, such as outpatient, inpatient, any type of patient contact, if you will, must be tested for tuberculosis. Okay. If they're working in emergency services, laboratories, long-term care facilities, all of these, and not just working, but if even if they're volunteering in these areas, they must be assessed. And so when we're thinking about CNAs, although they're not employed in the setting, they are still going to be in the setting and have contact, so they must be assessed. There are different ways to screen for tuberculosis. Of course, we know the traditional PPD method, which is the small, bubble underneath the forearm. But now, I don't know if you guys are aware or not, but the CDC, as of May 2019, are now suggesting that we move away from PPD testing and we start moving towards blood testing. Did you guys know that? Type yes or no for me if you knew that. So when we say blood testing, there are two different tests that you can administer to determine whether or not a person has truly come in contact with a tuberculosis bacteria, and that is the T spot and the quantiferum gold test. Okay, so T spot and the quantiferum gold test. So yeah, there you go, Victoria, the quant test. So those are the two tests that we are now moving towards. Yes, they are more expensive, but the plus side that is that we know people who have the BCG vaccine always test positive to the PPD. People who have had the BCG vaccine do not test positive to the quant or the T spot. Okay, so this is a more definitive test, and it prevents them from having to come back a second time, which sometimes can be a barrier because people have a hard time coming back the second time. So the CDC, again, as of May, is suggesting that we move away from the PPD testing and move towards the blood testing. All right. So now, what are your options as a healthcare, as a training center, right? What can you do? And one of the first, there's three main options I'm going to talk about today. And those main three options are you could either refer to a public health department, and I'll talk to you about that process. You could refer them, make an agreement with a local urgent care and refer them to the urgent care for this testing, or you can, for convenience, you can do it in-house. So I'm going to explain to you all three options and what those options would look like. Nicole says it's better than having to do a double negative. I know, right? Because then you have the two-step and it's just too much. So um, this is definitely a better way. But let's talk about it. So, option number one is basically refer them to the Department of Health. Every Department of Health must administer these PPD tests when necessary. So, if I come forth and I say, hey, I'm getting ready to get a job, or I think I may have been exposed, or I'm an immigrant, or whatever it is, the health department must administer a PPD test per request, and it is very, very cheap. I think I've seen it be anywhere from $7 to $12 for the PPD test. Okay, so um, this test, regardless, you may do a questionnaire. There is a PPD, a TB questionnaire. Even if the person does not have any possible anything on there that suspects that they may have come in contact with the tuberculosis bacteria, everyone, when gaining initial employment, must get a TB test done. Okay. Now they moved away from saying that you have to do it annually. That used to be a requirement. That is no longer a requirement. PPD testing annually is obsolete now. It is only in the event of an exposure or in the event of symptoms. All right. And remember, those symptoms look like coughing up blood, coughing at night with night sweats, fevers, chills, just this chronic cough with blood, fevers are some of the biggest things that we're looking for. So if a person has a complaint of any of those, then we might want to start testing them for that. But otherwise, if unless they've had any type of issue like that or they've come in contact with them, then there's no more annual PPD testing. Okay. But anyway, so back to referring them to the Department of Health. You can refer them to the Department of Health to have this testing done. And then when they go to the Department of Health, they of course would bring you back the form that states they were tested for PPD, for tuberculosis. And if they were negative, great. If they were positive, okay, that means two things. Does that mean that they have tuberculosis? No. That does not mean that they have active tuberculosis unless they have those symptoms like fever, chronic cough, night sweats, fever, things like that. Then yeah, you probably do have a person who has active TB. But there's also something called latent TB. Okay, latent TB means they've come in contact with the bacteria, but it is not active. So if a person doesn't have any of those symptoms, but yet their TB test comes back positive, then they have latent TB and it's just kind of sitting in the lungs, and it may flare whenever it's ready. It may not ever, who knows? But regardless, those people end up having to undergo, not testing, but they have to undergo treatment. And that treatment could be up to 3 months, and it has a lot of side effects to it. So, but anyway, that's a whole nother topic. So if that person does come back positive, they would have to then forego a chest x-ray. The chest x-ray helps determine if it is latent or if it is active. Okay, so if a person has latent TB and it is not active, they can indeed start with their clinicals as long as they're getting treatment. Okay, I want to be clear about that. So even if they come back positive, it's not sorry, you can't start clinicals. It's okay, you were positive, but is it latent or is it active? If it is active, no, you cannot. You can't, don't even, sorry, you can't enroll, right? You can't come until all this is cleared up. But if it is latent and they're getting treatment, or if they've already been treated in the past, then yes, they can enroll and start the program. Any questions about that? Does that make sense? Let me know. So anyway, so that's how the health department portion would go. All right, you are completely out of it. They're just going to the health department and bringing you the paperwork. The paperwork is important to you because in order for your students to go to clinicals, you must submit that to the nursing home. Every nursing home must account for every volunteer, every student, every employee that comes into their facility must have some type of PPD on file. Okay, so know that. Now, so that's option number one. How long is past treatment good for? Eternity. Past the treatment is good for eternity. So they only have to. It's one and done. As long as they complete it. Some people don't complete it. That's the problem. But as long as they complete the treatment and they've had treatment, one and done. Good question. All right. So the next one is referring them to a local urgent care. Now, I want you to identify if you're thinking, okay, I'm going to have a partnership with a local urgent care and I am going to send my students there, right? If you've kind of already got that, your mind made up that that's just easier, the patient, not the patient, the student doesn't have to pay anything, I'm going to kind of take care of it, or you can make them pay for it, either one. But it's easy, right? It's just an easy transfer because if they do come back positive, here's the next thing that we can do, and so forth. You just transfer them over to an urgent care. So you can find a local urgent care, usually like a mom and pop's urgent care, one that's privately owned. Kind of walk in there and say, "Hey, my name is so and so. I have a program. This is what I'm going to be doing. I need TB testing for my students, and you might have a nursing home that is requesting that the students must have a drug screen also, okay? Something to be conscious of. The nursing home may request that you have a drug screen. So guess who can provide you with that drug screen? Your urgent care. So I have students that are going to be TB testing, who are going to need drug screens, and who may potentially need a chest x-ray in the event that their PPD is positive, okay? So I plan on getting 10 students a month or 20 students a month, and all of them have to have this. So I plan on referring them all your way. What would be the fee for that? Okay. So talk to them about that, what that fee would be, and they would be happy. Hey there. Okay, now some of my students are coming in. But anyway, they'll be happy to go ahead and make that agreement with you and make that arrangement with you so that you can send those students there. Okay. Usually that arrangement, I've seen the arrangement go from $30 to $50, but then if they need a chest x-ray, it ends up being a little more because, as you can imagine, the chest x-ray costs more. Okay. Hey Katura, thanks for joining. So so that's that, right? Getting together with a local urgent care, not a big chain one because it's really hard to make an agreement with someone like that, but a moms and pops one, make an agreement with them. Send your students their way. They'll fill out all the paperwork and send it back to you. Now, another thing is physicals too. A lot of times, some states require that your students have to have a physical. Who can do your physical? The urgent care. So, really, honestly, no matter what, I think it would be very beneficial for you to have a relationship with an urgent care if you're going to need any of those drug testing, TB testing, chest x rays, physicals for your students, things like that. Okay. Just collaborate with one, figure something out there. Um, and then, any questions about that before I move on? Option number three is one that is it's very attractive to many people because it's a potential money maker. Um, and so option number three is actually doing it in-house, doing your TB testing in-house. All right, it looks like I don't have any questions so far, so I'll keep going. All right, so doing your TB testing in-house would look like the following, and this is where I want to share my screen. because I want to start pulling up some of the CDC. Um, let's see. I want to start pulling up some of the CDC best practices for you. All right. So the link I just sent in, please click the link. I don't suggest you go looking at it right now, but I want you to click that link and just keep it there. Okay. Keep it there for when we're all done and you'll have it to refer to in a minute. That link tells you about the different types of solutions that you can order and how they work. So let me share my screen. All right, guys. So I am now screen sharing. Let me show you the website. So this is the CDC's website, and this is information about the TB skin testing products. So if you decide, you know what, I'm going to do TB testing in-house, this could be an option for you. Um, they give you information about, getting the DVD for the DVD to help you explain how to do it. There is the TB ruler, which I'll talk about in a minute. Speaking of, anybody in here TB tested, certified? Are you certified to administer TB tests? Any of you, yes or no? Let me know, because if you are, then you'll know what I'm talking about. If not, then I'll know what to say. Okay, none of you. Okay. So perfect. So let me explain to you the process of becoming TB certified and what type of products you would have to move into. Okay. So I'm just going to do a quick overview of the products here. You have let's see, here's a chart. These are like little free free documents. Okay, this is a chart that you can just kind of print off and put on your wall, but it shows you what the different skins look like, the different reactions, what you would be looking for. You can order that information here. There's pamphlets and brochures, all types of free information here that you can just get for free. You can get some rulers and things like that. But yeah, so there's different solutions. I'm trying to see. I thought they explained the different solutions here. Okay, that's fine. But this is just a good tool. The solution usually is about 80 bucks for 10 mLs. Okay, 80 bucks for 10 mLs is usually what it goes for. I've never seen a 10 ml bottle go for any more than 100 bucks. So how many tests do you get out of 10 mLs? You get 10 tests, okay? Because it's 1 ml of solution every time you administer the test. So you can get 10 tests out of one small 10 ml bottle. So basically $10 or maybe $8 if it was 80 bucks per test. A lot of people charge 20 or 30 bucks to test in-house and get it done and over with, right? Or some people, require it to be in-house. So right there, you've already, if the bottle was 10 bucks and you're charging 30, you've already doubled the price back. You've already doubled your money back, more than doubled, tripled rather, your money back on the vial. Okay. So that's a small money making method you can use in house. All right. Right over here, let me show you this. Okay. So this is the TB. This is also, let me give you this link too. This is also the CDC's website. I attended a class. You need a doctor to administer this in order. Okay, I'll talk to you about that in a minute, Jasmine, because that's semi not true. Part of that is true and part of it's not. So I'll clear that up. All right. So here is the TB screening and testing of healthcare personnel. If you want to become certified, okay, to administer TB tests, right here where it says state or local TB control program is where you will click. Look at this. Every state, it gives you information. So for instance, Georgia is the Georgia Department of Public Health tuberculosis program. So they oversee the program and they certify you. And by the way, in most states, I'm not going to say all states, but in most states, this is a free program that you can go through to become certified. So you can utilize this link right here, your state or local TB control program. Just click it, click on your state and learn about the TB program, whether or not it's free. I think the one here in Georgia was like 2 days. It is free here in Georgia. And when you're done, they give you paperwork and you have to go and administer maybe like 10 tests in the field and then bring it back to become truly, truly certified. Okay. So that is to become certified to administer. So that's why I said, Jasmine, a part of that is not true. Anybody, as long as they learn how to do this, can truly administer the tests. Okay, that because TB is such a wide problem, that they're just training people to administer these tests and to be certified to administer and read the test. Now, to your point, a physician must order the solution. That is correct. So remember, I was telling you, you want to have some type of a collaborative agreement with an urgent care. That urgent care physician, if you wanted to do the actual TB testing in house, they may have an agreement with you where they'll write for the solution for you and you can have it in house. Okay. And then you're just referring people to them if the test comes back positive. Because remember, if the test comes back positive, they're going to need a chest x-ray. All right. And I'm pretty sure you guys don't have a chest x-ray machine in your garage. So you're going to have to refer them somewhere for a chest x-ray. 9 times out of 10, these people do not have primary care providers that they can just get into next week to get that chest x-ray and move forward. Most of them do not. So yes, you will need a physician to write for the TB solution for you. Once they write for the TB solution for you, and you are certified, you can administer the in your state, you can administer the TB tests. Okay. And here it tells you the TB screening program include the following. Remember, I told you inpatient, outpatient labs, emergency clinics, long-term care facilities, and so forth. Okay. So I'm going to scroll down here a little more. Remember, this is the CDC's website. And right here, remember I was telling you about blood tests? Remember I was telling you about the frequency of TB screening and testing? So it talks to you exactly what I said. Baseline testing is important. And then here is the TB risk assessment tool. So if you, for whatever reason, you want to do the questionnaire, you want to do the tool, you can click this and get that for free. TB symptom evaluation. If you're not sure how to assess the information you just pulled there, this is the evaluation tool. Okay. And then the TB blood test. So let's look at that. The TB blood tests, I'm gonna click on them so you can see them. And here they talk about the different types of blood tests. Remember, I told you you have the quantiferum gold, and then you have the T spot. So it talks to you about both of those. People who have received the TB vaccine, this is preferred for them because remember, it will not give you a false positive like a PPD test will, and so forth. So great information here, guys. Really, really, really great information the CDC provides you with. There was something I was just thinking about that I wanted to tell you. Okay, so I'll let you guys read over that information on your own, and let me stop screen sharing here. All right, so I'm going to start reading the comments here. Comments here are Katora says, I work for the health department in Florida, so I need to find out how I can get certified for them. Yes, exactly. And it may not be the health department in Florida that certifies you. They may divvy it out somewhere else. I don't know, but for the most part, it is the Department of Health that oversees that. Nicole says, can a nurse practitioner order the solution or does it have to be a physician? Great question, Nicole. And that depends on your state. So, for instance, in the state of Georgia, no, I cannot order the solution because in the state of Georgia, well, I mean, I can, but I have to have a collaborating physician to do it. I have to have a collaborating physician just to order birth control pills or to order Keflex or whatever it is. Some states say that nurse practitioners do not need a physician at all for anything. And so in those states, for sure, a nurse practitioner could order the solution without any problems. Okay. So, yes, nurse practitioners can order the solution. Um, but some states we may need a collaborative physician. And if we need a collaborative physician, if we don't already just have a collaborative physician, like I already just have one for my own personal reasons, so I don't have any problem writing for it, right? But some nurse practitioners do not have a collaborative physician that they hire on their own. And so they would have to go out and hire one. And going out and hiring one to be able to write you a prescription for PPD solution may not make sense for them from a money perspective. So therefore, a physician in those situations may be better. But if you have a nurse practitioner that has their own practice or practices independently, then yes, I would. I'm pretty sure they could help you with that. Um, Okay, no, that's okay, Victoria. So, Victoria said, so the provider who you partner with may write you the prescription in your name or the facility's name. Okay. Good question. The prescription, how do I write that? Because I've written it before. Um, it was just written out in my name as the provider, if I remember correctly. But to be honest, Victoria, I don't know that that's something you really, really have to worry about. You can let the provider figure that part out. I think I wrote it out to myself or to one of my nurses at the facility. I can't remember. Okay. Um, but good questions, guys. So, all right. So let's recap on that. Okay, real quick. Let's recap on that. So, if you want to do it in house, you can have a physician or a nurse practitioner order the solution for you. You can keep it in house. It must be refrigerated, and anyone can purchase the syringes. Anyone, okay, can purchase the syringes to administer it. If you become certified through the state to administer the PPD test, and trust me, it is important to become certified because once I got certified, I learned so much that I didn't even know before, especially in reading the PPDs. So it is a really, really good program to go to. Jasmine, I think you said you went through it. Would you agree that you learned a lot more than you thought you already knew about PPD testing? So it is a really good program. Go through that. And then once you become certified, you can administer and you can read. Okay. Now, the next thing is, excuse me, the next thing is that you would need to do is then determine if that test comes up positive, what are you going to do? Okay, for tests that come up positive, then you know that you need to refer them for chest x-rays, period. Okay. And then that person will then determine, okay, is this active? Is this potentially latent? Do the chest x-ray and so forth. Once they do the chest x-ray, if the chest x-ray is positive, then they won't be able to go. If the chest x-ray is negative and is latent, then they can. Now, the problem is the chest x-rays could be pretty expensive, guys. I've seen some people trying to charge $100 for these chest x-rays. So if you get an agreement with a physician and he knows at urgent care and he knows you're going to be constantly bringing him people, I mean, he may be willing to do it for $50 or, um, 60 or who knows, he or she. So I highly recommend that you find an urgent care to refer these people over to, just get that collaborative relationship so that you can get that discount for your students. Okay. And then after that, again, if they need drug testing, if they need any type of, I don't know. I'm interested to see if coming up here soon they're going to do away with PPD testing for good, and it's just going to be strictly the blood test, the quantiferum gold, and the T spot. That's going to be interesting. The quantiferum gold, I think, is way more expensive than the T spot. The T spot is a little cheaper, but both of them are anywhere from 30 to like $75, depending on the lab that you go to. I've seen all the way up to 150. So it can be very expensive, but it'll be interesting to see if we end up moving in that direction. Nicole says, do you have any additional approach suggestions as how we can get a physician to say yes? For example, offer them dollars, etc. Yeah. So again, if you come to a physician and say, hey, I want to do this in-house, remember that barter. So I'm going to be having people that are going to come back positive. We know this. We know a lot of people who have had the BCG vaccine are going to come back positive, so they're going to have to get referred over for a chest x-ray. More than you know, you're going to get that. So, yeah, you write the solution for me, I'm going to be sending people to you. That's one good bartering strategy. Or if they want a dollar amount, I mean, if they want a dollar amount for you to pay them for this solution, prescription is probably not going to make sense for you because the prescription in itself, remember I told you, is about 80 or $100, and it only does 10 tests. So you might need that twice a month, depending on how many students you have. So that's $200. Plus, you're having to pay that physician. Let's say want $200 to do it or something. That's $400. I don't know that that makes sense to you. So if they're going to be charging you, then it may not make sense. But if they're willing to barter with you and say, hey, I'm sending all my physicals, I'm sending all my drug screens, I'm sending all this to you, all I'm asking in return is for you to write for me the ability to do this TB testing, then they may be open to it. Some of them may be greedy and want the TB test themselves, and so they might say no. I'm just going to be honest. They may, who knows? But that's the only bartering option I would suggest, because from a money standpoint, it could potentially cost you more. Victoria says, would you suggest the cost of a chest x ray to be absorbed within the center or at the student's expense, as this may be unexpected cost for them? Unfortunately, this is going to have to be an additional cost for them, Victoria, because you cannot anticipate, you can't just automatically say everyone's got to pay for a chest x ray, because everyone's not going to need one. And then it's hard to say, okay, well, I'm just going to kind of up the charge on everybody. And then when a chest x ray is needed, they get it for free. That's kind of not fair either. So they're just going to have to understand and know that, hey, with TB testing comes the potential that you may come up positive. And if you do, you're going to be responsible for your chest x ray, not the school. That does need to be stated up front. So, very, very good point. Very good point. And that's something that, again, you'll want to put in your policies and procedures. Don't you love why we have these discussions? Put that in your policies and procedures to state, giving them the ability to understand that there is a potential for this, and that is a cost on you, not the school. Deja said, did I hear that they are moving towards blood testing for TB? Yeah, Deja, you probably just got here. Yes, the CDC, and let me give you the link. The CDC is now recommending that we no longer do TB tests as of May 2019, and that now we move to blood testing. However, everyone has not moved over to that yet, and so a lot of people are still doing the PPD test, but I'm just letting you guys know that that is no longer best practice. And so, in the next few years or so, we may see the PPD test becoming obsolete. So that's the CDC's website to give you information on that update. Okay. Nicole, does the state come to audit your TB services? No, they don't. Like, who is purchasing your solution? Need proof of certification? No, I have never seen any CNA program um, come and worry about who's doing your TB and are they certified or anything like that. I've never seen that. That is, again, if you went and got certified by the Department of Health in your state and you're administering and doing it in your school, that has nothing to do with them, because they do not regulate it, if that makes sense. So that's not anything they can come in there and give you grief about if they don't regulate it. But again, who really cares about it is the nursing home facility. The nursing home facility is the one that really cares about this test. So I don't know if they're going to be questioning you or having issues with you doing it in house. I haven't seen that. I haven't seen that at all. Anyone having a problem with you doing it in house. As a matter of fact, many nursing homes do it in house too. So that may be something for you to also to think about. Now that we're having this discussion, if the nursing home you partner with does it in house, then maybe they're interested in partnering with you to do your TB test and you pay them. I don't know. Um, it's a thought. Katora says, at the health department, we no longer complete two-step testing for all employees. We draw the TB gold and quant. Yeah, because Katora, that's now best practice. And as a matter of fact, the urgent care that I moonlight at, we no longer do PPD testing either as of May. As of May, we have now moved to TB and quantiferum. I'm sorry, T spot and quantiferum testing, because we do immigration physicals, and immigration is no longer accepting PPD, again, because the CDC no longer recommends that as a means. And then again, everyone who's coming from another country, most of them have had the BCG vaccine, so it's like a test that we're just doing just to be doing it, because we know it's going to come back positive. We already know we're going to have to chest X-ray them, and it's unwarranted radiation. So why are we even doing this? So it makes sense that we're moving towards this TB, T spot, and quantiferum testing. Yes. So again, I suspect that we're going to see that all over. All right. Any other questions, guys? This was kind of a short but sweet discussion. Which option do you guys like the best? That I gave you? Do you like the just referring them on out option, referring them over to the health department? Do you like getting a collaborative agreement with an urgent care and just letting them take care of it for you? Or do you like the idea of doing it in house? Tell me what you think. Victoria says the urgent care because the other services that they will need. Yeah, I agree. I want to see what else you guys say. I'm going to be 100% honest with you. I did all three ways. So when I first started, I was sending them out to the Department of Health, and that became a headache because a lot of them did not have transportation. They didn't know where the Department of Health was. They didn't understand the hours. They didn't know who to talk to. Like, it was just a headache. I was like having to walk them and hold their hand through the entire process. Um, I had the form already that the Department of Health would use. It had the address on it. It was still an issue. So that became annoying. So then I started writing my own scripts and doing in house TB testing. And to be honest, I'm going to be 100% honest with you guys. Yes, I was able to make a little money off of it, but it wasn't worth the headache. It was kind of a headache, that every now and then I had to go and pick up the solution. And then, if one of my instructors didn't tell me we were low and I had a new class coming in and there wasn't solution there, and then I have to go order it, but the pharmacy didn't have it and it was going to take, a week for it to come in. And it was just little stuff that I was like, okay, this extra 100 or $200 I'm making off this vial is so not worth it. And so I just did away with that part of it. And then I was having students, um, that were getting, if they came back positive, and then I had a physician who I was referring them to for the chest X-rays. They were giving me a headache about going back and forth with me about that. I just wanted out. So I finally did go ahead and get a agreement with an urgent care, and it just made my life easier. I'm going to be honest. I just said, hey, this is what you need to do in order to get going. Go over here. They're going to provide the service for you. Um, I had the option of either paying for it for them, right? With their, students pay for when they come, they pay for, what is it, the application fee, right? So I had the option of just utilizing their application fee to pay for those testing for them. So they felt like it was free or a part of enrollment. Or I just referred them and had them pay on their own. And I ended up finding out, although I offered all inclusive everything, I just had them pay on their own because then when it came back positive, it was more headache about the money. So urgent care was better for me. So let me see what you guys are saying. Nicole said, I do want to offer a referral and do it in house. Okay. Yes, like some of those people that are going to come back positive, there's not even any reason to be TB skin test them. Couture says urgent care, but we have several chain urgent cares. Yeah, but I'm telling you, there's a mom and pop somewhere. So find the little small mom and pops, find the owner, sit them down, talk with them, and tell them what it is you're trying to do and see what they say. In Florida, we have so many students from the Caribbean that the BC vaccine, there's no point in doing it in house. Gotcha. Yep. Nicole says, sorry, offer the students a choice between doing it in house or okay, and referral. I like that. So Victoria says, do you provide the students with a TB form or do the urgent care centers provide one for them? I had a TB form that I had that I provided them with that they took with them, as well as a physical form for physicals and things like that. So that's another form you'll have to make. Or I think there's actually one on the CDC's website that you can pull for TB testing. So yeah, you can. There's a wealth, as you see, there was a wealth of information. There are a lot of links that like click you other places and you can get lost. So but there's a lot of great free information there. Jasmine, I'm going to refer students to the urgent care. Yeah, I that's what I ended up doing, and it was a little bit less of a headache, especially when you're the main one doing everything. Like when you guys are looking to start your CNA school, I know a lot of you are going into this alone and you're not having business partners. Trust me, when you're doing marketing, when you're teaching, when you're program coordinating, when you're janitor because you're cleaning the toilets, when you're mopping and you're making the bed and you're taking sheets home to wash them and you're bringing them back, like the last thing you want to be worried about is some solution all over extra $100. I'm just being real with you. Now, once your program is flowing really well and your hands are a little bit off and you've got other people making things move for you, then yeah, it might be something you want to consider, especially if you got 30 and 40 students flowing through there every month. And yeah, that's going to be a good money maker for you. So it's just something to think about in your business. You're going to have different aspects of your business. and you're going to grow, and then when you grow, there's different structures of your business that are going to grow or that are going to change. So you'll notice that in your business, you're going to be always reassessing and changing things. And that's okay, because if you're not reassessing and you're not changing things, then that means you're not growing. Or you're not, maybe you are growing, but you're not looking at how you're growing and how you can be better in that growth. So I challenge you guys that once your business is up and going, that you are constantly reassessing and reevaluating things. Jasmine says, in Georgia, you don't have to be an RN to get certified for TB. If you decide to do it in house, the admin can get certified. Just a thought. I like that. Thank you, Jasmine. Victoria says, if you are including this into your fee, do the urgent centers bill you for the students that come through, or is there another way? That's something the two of you can try to figure out. Um, yeah, that's something you can figure out. For us, I paid per student that ended up going over. So if, like, for instance, if I knew that this month I had 10 students enroll, then I went ahead and just sent them that money for those 10 students, and then they took care of it that way. But that was in the beginning. I ended up deciding to just have the students pay for it on their own and just stay out of it. I just wanted out of that part of it after so long. I was already doing so much for the students, like ordering their books, ordering their uniforms, ordering their stethoscopes, like getting all their stuffs ready, that this was one thing that I just decided. I have an agreement. It's only going to cost you X amount of dollars. You can take the initiative to go over there and get this done on your own. It's the only thing I'm asking you to do, right? I'm doing your CPR. I'm doing everything. So, any other questions for me, guys? You guys have really great questions. I always love how you guys engage with me. I'd like to know, if you found this helpful. Victoria says this is helpful. Okay, good. That's my question. I want to know if this is helpful. And then, in addition to knowing if this is helpful, I want to know what you want to learn about next. Tell me what has been a topic that you wanted to know about. Type that in for me so that I can, because I'm sure if you had that question, somebody else did. So I want to be able to provide you with what it is that you need. So you guys are people who are working with me. We've already done business together for the most part in some shape, fashion, or form. So it's my job to add as much value as I can, give you as much value as I can through this process. So you tell me what else it is you'd like to learn. No, Katora, I am the worst with typos, okay? So please don't worry about it. I'll make posts and then I'll read them 2 days later and see all the horrible typos. So yeah, I'm bad with that too. It's okay. But yeah, the nursing home too is something to think about. All right, guys. Well, if that is it, I'm going to thank you so much for joining me. And if there is a topic you think about, just email it to me. I want to give you guys what you need. Drug screens. What is determined acceptable and not acceptable in equipment? Okay, those are good ones. Very good topics. That drug screen, what's acceptable and what's not acceptable. Um, that's going to be an interesting one. So anyway, so yeah, I'll put some of that stuff together. Equipment, I like that one. I think that is a good one because a lot of states do not have an equipment list. So I'm trying to put together an equipment list, like a generic equipment list. And as you guys know, I have a partnership with Pocket Nurse. And so Pocket Nurse is actually going to put together a catalog for CNA schools like yourself who are looking to start CNA schools. And it's a catalog with just strictly the equipment that would be needed for a CNA school. So I'm working with them to put together a catalog. So that is actually a really good topic. Because that's something I'm working on right now to help them build that catalog. And then hopefully when that catalog is built, it can be sent out to you guys. But in addition, I'll have a generic form that I can provide you with too. Tips on how to furnish your school on a shoestring budget if you're not a nonprofit. I know that's right, Nicole. All right. So I like these topics. I'm gonna write them down now. Furniture. You guys are so welcome. Thank you so, so much. Any other questions for me? Um, yes, Nicole, I agree. But Victoria recommends offer up in Craigslist. Yes, I do. But to her point, there are like items that you may not even think about that you need to have. Um, like for instance, I don't know if you guys know this or not, but every CNA school, as a federal regulation, is supposed to have a library. And the library can just literally be a bookshelf with 5 or 6 reference books, but you have to have that. So that's something that a lot of people don't know unless you've read into the requirements. So that would be a piece of furniture that you probably would need that you didn't think about, right? So I think Katora, I think you I mean, whoever asked the question, I think it was Nicole. Nicole, that's a really good question. So I think I will put together something for that too. Okay. And did you guys know that it's a federal requirement that you have to have a bookshelf? It's all these little things. I'm telling you guys, all these little things that you not a bookshelf, but a library is what they call it. Um, yes, Victoria, have one. Have an area with reference material. I don't know how I keep all this stuff in my head. It's a lot. And then when you guys ask me something, it pops up, and I'm like, oh yeah, about that. So I need to do a really good job of just trying to get all this down on paper. But even if it's down on paper, people don't read. So it's my job to try to give you as much of this as I can because you're overwhelmed, especially if you're filling out your application. There's already a lot of things you're reading and looking at. So getting the information directly to the ear, I know is very beneficial. So, but yeah, so I'm going to get going. Again, I'm going to plug my mentorship program. If you are following me and you are not in the mentorship program, that's what these type of videos are for. I'm going to be doing these type of videos for people in the mentorship program and then more like actual working webinars where I've already got 3 people lined up. So I have one individual lined up who does business credit. I'm excited about her. She will be doing a webinar on business credit, helping you get your business credit game up. And that's a working webinar. I mean, you're going to be doing it right then and there, right? All these are working webinars, and these are individuals who are guest speakers, guest experts, if you will. Then I have another webinar from an individual who is a ads expert and a Google expert. So I want him to help us do things like once you get your website up, I want him to show you how to connect it to Google Analytics. I want him to show you what does that mean, how to look at your Google Analytic data, how that data helps you as a business owner. If you have a website and it's not connected to Google Analytics, you're losing big time. I'm talking about huge. Okay. Um, I mean, you may as well not even have a foot in the game, like you just playing. So you have to have it connected to Google Analytics, and you have to know what that information means. So he'll be doing a webinar on that. He'll be doing a webinar on organic traffic. I think some of you, Victoria, you attended one of my info sessions, and I kind of already gave you guys a spill on organic traffic. But again, these are working sessions to get that organic traffic working for you. And then I have another individual. Her name is Renee Davis. I'm super excited about Renee, and Renee will be coming in and helping you guys with engaging instructor development. So basically, how can you engage your students to keep their focus when lecturing to them? Very good stuff. So anyway, if you're a part of the mentorship program, these type of webinars is what I'm going to be delivering to you once a week and once a month from guest speakers to help you build your business and make sure that it is the best business that it can be. So if you like this and you like information like this, I promise you, you want to be in the mentorship program because the mentorship program will be the only people getting this type of information. Okay. So thank you guys so much for joining me. If you have any questions, like I said, always email me and I will talk to you guys later. Have a good night. You are so welcome, Katura.